how many cases do you think the U.S. will reach? 1 million cases, 10 million cases, or do we not even have any idea?
You know, Jake, to be honest with you, we don't really have any firm idea. There are things called models. And when someone creates a model, they put in various assumptions. And the model is only as good and as accurate as your assumptions. And whenever the modelers come in, they give a worst case scenario and a best case scenario. Generally, the reality is somewhere in the middle. I've never seen a model of the diseases that I've dealt with which the worst case scenario actually came out. They always overshoot. So when you use numbers like 1 million, 1.5 million, 2 million, that almost certainly is off the chart. Now, it's not impossible, but very, very unlikely. So it's difficult to present. I mean, looking at what we're seeing now, you know, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target that you can so easily be wrong and mislead people. What we do know, Jake, is that we got a serious problem in New York. We have a serious problem in New Orleans, and we're going to be developing serious problems in other areas. So although people like to model it, let's just look at the data of what we have and not worry about these worst case and best case scenarios.
I'm Shimon Prokopez inside the Javits Center in Manhattan, where officials have created this field hospital. You're seeing beds, blankets, other items inside these rooms. You have a plant, there's hand sanitizer, and this is all across the hall here throughout this convention center. This convention center lines 6 blocks around Manhattan. All across the halls here, you can see down here, there are other sections that were made into rooms. FEMA building this out with construction workers, the military here. And then inside these rooms, there are also the orange bags that are going to be given to the medical professionals. And inside a lot of these bags are what you would find in any medical facility. There are scissors, gauze pads, there's hand sanitizer. There's even equipment that doctors would use, a stethoscope, gauze pad, tape, other items in here so that nurses and doctors could protect themselves as they begin to treat patients here. There's also honey. They've given some of these patients, they're going to give them as they come in to their rooms to try and give them some comfort in what they're going through. There's lip balm, and then there's honey that actually the Jacob Javits Center on their roof makes on their own. This site hoping to be open next week. The governor says he wants 4 more locations like this across the city, across New York City, in each borough, from the Bronx to Staten Island. He's hoping that the president will approve some further assistance so that they can open those locations to try and relieve the stress from a lot of the hospitals that are facing an enormous amount of patients as they try to deal with the virus and its spread throughout this city and state. So hopefully this gets opened next week, and then there will be more places like this set up across New York.
In Arlington, Virginia, a well-protected technician approaches a car at a drive-through coronavirus test site, gives instructions on a bullhorn to a patient on the other side of a closed window. The patient then pulls behind a building to another checkpoint to get tested. Officials at Virginia Hospital Center, which runs this facility, say they're doing about 50 to 60 tests a day. Millions of people in the United States and around the world are asking critical questions about getting tested. To start, how do you know if you need a coronavirus test?
Upper respiratory symptoms might start this with runny nose, sore throat. It generally then leads to cough and shortness of breath.
Then, when you have a strong indication that you need a test, who should you call first? Officials say don't just show up, call ahead.
You would first notify your family doctor, and that physician will do a screening to see if you meet criteria to be tested. We don't want to test well individuals. Once the physician's assessed you, he'll or she will determine if you need an order. They would write that order, then you would call the scheduling line and make an appointment.
At this facility in Arlington, when patients arrive, they need to keep their car windows up until it's time for the test. Here, the test takes about 10 minutes, and results are given back in 5 to 7 days. But many remote testing sites are under more strain than this one. Some localities, like New York City, are running so low on masks and gowns, they want to limit testing to those so hard hit they are hospitalized.
Every test we give takes up valuable personal protective equipment that can be used when we're treating those that are in the hospital.
The Department of Health and Human Services is prioritizing for coronavirus tests patients already hospitalized, health workers with symptoms, elderly people over 65 with symptoms, and those with compromised immune systems and underlying conditions with symptoms. If you do take the test, be ready for some discomfort. At the Arlington facility, they insert a swab at the back of the throat, but it varies.
The test was very quick, but it goes a fair amount up into your sinuses, and it's not comfortable.
The nursing officer we spoke to at the Arlington site addressed other crucial reasons why drive-through and other remote test sites have been set up.
We are trying to prevent unnecessary trips to our emergency department for individuals who are seeking this testing, so we're giving them a means to do that. Secondly, it also saves a lot of personal protective equipment to do it this way.
Another commonly asked question regarding places like this is, can more than one person in a car be tested? The people who run this facility say anyone in the car can be tested as long as they have an appointment and have been referred to this place by their doctor. As far as how long this place is going to remain open, the people who run this facility say as long as they have the personal protective equipment that the workers here need.
I mean, who ever thought that people would be comfortable pouring their hearts out in a parking lot? And this is our confessional, actually. This is where we would come in here for confession, but that's just not possible now. So we said we're bringing it outdoors.
I tried to come to confession during Lent with the coronavirus, shutting everything down. I figured, well, that wasn't going to happen this year. I think it's great that they're making this available to people.
How are you? It was important for people to know how much their priests love them and care about them, and will go to any lengths that we can, safely and prudently, to reach them.